So my name is Chris Denton. I'm a professor at the Royal Free Hospital in London, University College Medical School, and we specialise in a rare rheumatic disease called scleroderma, or systemic sclerosis, and this is the topic of my lecture at this conference. Scleroderma is an uncommon disease. It affects around 1 in 10,000 people, but it can be very severe. Unfortunately, a lot of patients still die from scleroderma, and they die because they develop problems in the internal organs. Scleroderma means hard skin, which means that patients develop inflammation and fibrosis in the skin, which limits their movement and can affect the hands and function. But as well as affecting the outside structures, some patients develop similar changes in the internal organs, especially in the lungs and the heart and the kidneys. These complications cause a range of problems and can ultimately lead to life-threatening impact on these structures. So, being rare, many doctors have not seen many cases of scleroderma, and many patients, when they first develop the symptoms, are unaware of what they might mean. Most patients with scleroderma first develop a problem called Raynaud's phenomenon, where they get cold in the extremities and poor blood flow to the hands and to the feet. They may then develop some symptoms of indigestion, reflecting involvement of the gut. At this stage, they often consult their doctor, and a diagnosis can be made if they have the right investigations. These tests include blood workup that looks for autoantibodies, which can be very specific. These blood tests allow you to suspect scleroderma and then move on to see the appropriate specialists. And it is important that a scleroderma patient sees a specialist, a rheumatologist, or another doctor who understands the condition. Because once the diagnosis is made, they then need to have tests to check the heart, the lungs, the kidney, and the other internal organs so that they can go on to treatment. Fortunately, although there's no cure for scleroderma, there are emerging treatments, and this was something I was able to highlight in my lecture. There are treatments now that can improve the skin, that can start to improve the lung, and can treat the very severe complications of pulmonary hypertension and of scleroderma renal crisis. Renal crisis in particular is a complication that now has a much lower impact on the disease than in the past. So all in all, although it's still a very challenging disease, there are signs now that, as with other areas of rheumatology, there are advances, and we're doing studies that are showing benefit of treatments. And so I hope over the next few years we'll see further improvements.